Hi everyone, good morning. My name is Jack and I'm representing a team from Nanyang Technological University in Singapore. I'm very glad to be here to share our work. Also very excited to hear your views on how we can drive more people to use participatory surveillance apps. There are many good reasons to leverage participation in managing diseases, both from the standpoint of the general public as well as from the standpoint of public health. I would like to point out that the reasons you see here are framed more from a public health standpoint than from an end user standpoint. And we know that in order for participatory surveillance to work, certain conditions have to be met. Enough people have to have the requisite devices, infrastructure has to support those devices, most importantly, people have to know how and they have to want to use the devices when we ask them to. Singapore has a high smartphone penetration rate. Mobile transfer speeds are also among the highest in the world. So when the news of the pandemic hit, we asked ourselves, how can we take advantage of this high connectivity and high mobile adoption? How can we leverage mobile devices for public health? And so we called our friends at the National Center for Infectious Disease and Ministry of Health, and COVID Tech, our mobile app, was put together very quickly. And we could respond very quickly because of experiences that we've had with these two apps, FluMob and FluTech, both of which are inspired by InfluenzaNet and flu tracking. COVID Tech was published on both iOS and Android OS. The app provided information on COVID-19 and prompted users to run through a checklist of symptoms. Informations of symptoms were provided along with directions to the closest medical clinics, and here are just some screen grabs of the app. And the idea was to track health symptoms within the university community whilst educating stakeholders on the virus, which should then empower users to protect themselves, such as avoiding crowded spaces. It would also allow us to analyze user interactions and transmissions. To drive adoption, we reached out to university students and staff to participate over a 6 to 8 week period, but it's not enough for users to just download the app. We needed them to use it and to use it regularly. And so we cracked our heads and piggy banks to think of possible incentives. We came up with a system to award points for each of these milestones. Each milestone is worth roughly 70 US cents. Users exchange them for vouchers at fixed time intervals. As long as people kept using the apps, we could monitor symptoms and run surveys through the app. But just as we were ramping up, lockdowns arrived and a national contact tracing app was launched. People were required to use the app to do things like access supermarkets, enter buildings, and book vaccinations. And very quickly, the National Trace Together app overtook COVID Tech to become the COVID-19 super app. What made it the super app? Well, for one, it has more features, but because it is mandatory, it becomes super, right? Because more users equals more data, higher accuracy with contact tracing, higher economies of scale to incorporate higher value-added services. It becomes easier to convince people to use the app when the app can demonstrate practical and social value to users. Trace Together can, for example, tell users if they have been near COVID-positive cases. The more information the app gives its users, the more users can be empowered. And this is only possible because other people are using the app and feeding it data. Perhaps the use of PS apps can be compared to the wearing of face masks. We wear it to protect ourselves, but also importantly to protect other people around us in our community. It would be remiss of me to not mention the obvious. Not everyone was on board. Many people believe that the data collected will be abused. The less digitally savvy are afraid to use the app. Also, we can't assume that everyone has a good enough phone or a good enough data plan. Tackling all of these barriers will require us to take a more human-centered approach in design and messaging. If one doesn't understand why, how is irrelevant. If moral obligation and protection motivation aren't good enough reasons and the use of PS apps cannot be made mandatory, user value and utility will be critical for success. Integration with social networks and gameplay can surely make PS apps stickier. As we communicate benefits, we mustn't neglect to address user resistance. Trust between policymakers, practitioners, and people will be critical. This pandemic has shown us how trust can influence public health interventions and outcomes. I know that many people in this room love data, and indeed, participatory surveillance apps can give us an abundance of data. It is nevertheless important to acknowledge that there are limitations with parsing, analyzing, and interpreting this data. Assumptions have to be made, and human biases will rear their ugly heads. Despite all of its challenges, PS apps have a lot to offer. It is easy to imagine how much worse the pandemic could have been if not for participatory surveillance. There is so much more to do, and I will leave you with these ideas for your consideration and for our discussion. Thank you once again to the organizers and to all of you for listening, and I look forward to connecting.